Okay. Join to.
And thank you all colleagues and participants to join us. Good morning, good afternoon, good evening, anywhere you are in the world. We're delighted this is the first meeting of the International Society of Health Education. This is a great development, which is really the result of partnership of many leaders around the globe, from United States, from Europe, from the Middle East, from the Far East, from Southern Asia. Welcome everyone. And I think we now, all of us could easily come to the conclusion that COVID-19, which I believe is the trigger for the foundation of our international society, taught us a lot of lessons so far, and there are more to come. That people awareness about infectious diseases and the risk of transmission of diseases are not only essential, but it is part and parcel of modern living. There are a lot of misinformation, fake news, people are misled. And one of the key objectives of this society, among many others, is really to inform people what are the medical facts, what are the health facts, what we are talking about. You will get in-depth information from experts around the world who are the frontline people who are doing the services, meeting healthy people as well as the lucky patient who require help and support. Not only in COVID, but this is opportunity using COVID platform to look at much wider aspect. Today, for example, we are discussing about leadership. Again, we discussed this between us on many occasions, people raising the red flag about whether this country or that country or this health services or that health services have sufficient leadership in this critical period in the history of humanity. And we notice in some countries how weak that leadership, whether political leadership or indeed health leadership. Let us focus today on health leadership and let us learn from the expert. Welcome everyone, and you will see more from this absolutely fantastic product, the International Society for Health Education. And we look forward to see you again. And we look forward for you to disseminate the information. The more you send it to people, the more you share it, the more there will be benefit, not only for yourself, but for the people who actually surrounding you and in your network. Every one of us got a network. This is an opportunity to spread the good news. Thank you very much and see you soon.
Thank you so much, Dr. Salman Al-Rawaf, Chairman of Society. Now, Professor Dr. Majid Jawad. Dr. Majid. Okay, no problem. Now, Dr. Rafid Aziz.
Hi, hello everyone. Good afternoon. Thank you for inviting me to join you in this talk today. And also I'd like to thank all my colleagues who are joining this program, for the International Health Education or Society of Health Education. It's my pleasure really to be with you, and I would like to thank you all and to congratulate you for this effort and for this association. I was asked to talk about the effect of age, gender, and previous experience in the health leadership. I have a presentation with me, I can share that with you, but I thought we talk and we go through it, if you don't mind. Regarding the age, before we go through that, I mean, the leadership is the ability to influence, either directly or indirectly, the behavior and the thoughts and the actions of significant number of individuals that the leader have in their teamwork, in their team. So it's kind of how you influence that through the behavior and their behavior, influence their thoughts through your thoughts, and how you can make the actions all directed towards the aim of the team. When it comes to leadership, I feel that age doesn't matter. It is competency that does matter. History is full of examples of leaders who have succeeded and failed at every age. History telling us about young people who managed to be very good leaders and young people who failed as leaders, and the same with older maybe people who succeeded or failed. So I don't think age is what we need to look at. It is the ability of that person to provide the leadership and to lead a team to get their goals and their targets. The intangibles of passion, character, commitment, and the talent of that person is a greater importance than someone's date of birth. With age, of course, you will get the wisdom. I mean, all we know that the older you get, the more wise you get. With old age, you get more firm, and usually senior leaders does not become easily swayed with the trends and unexpected crises. With the age, you get more loyalty to your organization, and that's important to get your targets and to lead your team. But with the age also, sometimes it could be resistant to change. I mean, old leaders are the most difficult to convince that change is necessary. Not all of them, some of them. They firmly believe that if it is not broken, why to fix it? It takes time for them to accept the possibility of changing protocols and procedures. So we have some cons here. There are some challenging in adapting. It's not easy to accept to change. As we said, hard to teach old dogs new tricks. There might be difficulty in letting go. It means that when they reach that level of seniority, it might be difficult for them to move to another position, and difficult for them also to leave that position they reached. So I think by that I will finish my talk regarding the age. Let's go regarding the gender. I don't think gender is important in leadership. I mean, yes, I know that there's a gap between male and female in the number of clinicians or number of leaders who are from the female gender. But this is something we need to work on and need to improve it, so we can bridge that gap and we can have equal opportunities for both genders when it comes to the leadership. It is not something negative about the female, but maybe they didn't have the opportunity to go through the path to lead the leadership. Of course, everyone have their way in leading, and it might be my leadership skills different from the others, but at the end of the day is how I can lead my team and I can achieve the targets and achieve the the projects that we work together as a team. There's different leadership styles, and there are different leadership for different leaders, as I said. So it might be, I mean, I'm not sure about that, but maybe like a female leadership is different from male leadership. I cannot comment on that. I don't have anything to support that, but definitely, I mean, there are good leaders from both genders. Previous experience, yes, it is important to have previous experience when it comes to the leadership, because then you will get whatever learning you have from previous work, previous projects you have done, especially in the health sector. And for me, I mean, if I look at myself, I mean, when you look to someone as a leader, we need to look at if they know their limitations, if they know how to motivate through any transformation, if they know how they put the people ahead of themselves, if they know how to empathize with their team, and they know how to focus on elevating others. And it doesn't come from nothing, it comes from experience. Looking to my experience in leadership, for about now 14 years or so, I always say that I should have a vision and keep things simple. This is the first thing. I always say that we have to learn by measuring. It means that how we know that you move from one place to the other. We put some measures, you put something that you can measure, and then you can judge if you have moved positively or negatively. To look at what is the best approach for your team. I move teams while I move through my leadership. And in every team, there are different ways you need to lead with your team. That you need to try different approach maybe for every team. You cannot manage different teams with the same approach. I always say that as a healthcare leader, you have first to look after your team, the team who look after the others. And I say that, and in my always, communication with our clinical fellows and colleagues and peers in Iraq, I always say that we need to protect our team in Iraq, our clinicians in Iraq. I mean, this is a simple thing. We do that all the time here. We need to look at that. It's important. I mean, if you want someone to look after others as patients or service users, then you have to show them that you look after them well. You have to empower them as well. You have to respect them. You have to listen to them. Empowering others is very important. And sometimes you can't imagine, I mean, just simple thing and maybe simple word of compliment, how you manage to make them move the extra mile for you and to reach the target. And sometimes they feel it is difficult to reach. And most important thing, which is we have to learn as we teach. Learning is ongoing process. And as a leader, you always have to learn from the others. I always learn from my team, from users, service users, from other teams, and I reflect on that, and I improve my practice, and I change my practice sometimes completely from what I'm learning, of what I'm learning. I think that's all for me for now. I understand that the time is limited, 10 minutes for each, so I thought I make it short, but I'm happy to take questions. Thank you all for listening. Thank you very much indeed.
Thank you so much, Dr. Rafid. Now, Dr. Professor Majid Jawad. Welcome, Dr. Majid. How are you?
Hello. I'm sorry, we are running into problems. I'm using my data, so I won't be long. Okay, right.
Okay, no problem. You can start. He will
Okay.
talk about criteria of innovative leadership. You can start,
Right.
Dr. Mujib. Okay.
Thank you very much, and lovely to see you again. And this is the only good things about Corona, you know, just keep us on Zoom all the time. Okay. And greeting to everybody from London. As I said, I'm very, very sorry for the interruption of our internet with the Virgin thing. So I'm using my data on my mobile. So
Okay.
you asked me, Maytham, thank you, for innovative leadership. Innovative leadership is, is a process of fostering innovation through developing innovation friendly culture and setting strategic direction that guide and build trust among the employees to innovate. So the word innovate is to create new things. Okay, that's what, you know. So every company, every organization, now you are doing a new organization, okay. Like any phenomena, innovative leadership idea is, for some, is blurry among different people, and some experts have even divided in their opinions. But sustainable, in order to have a sustainable organization or competitive company, you must have an innovative leadership and a culture within the team. Okay. So the innovative, sorry, I beg pardon. The creativity, for example, is when we say innovation is a creative, okay, one new thing. It's the ability to transcend traditional ideas, rules, patterns, relationship, or the like, and to create meaningful new idea. Innovation, as we say, is something new, innovation. With the organization, process, and tools, translate ideas into a new process, products, services, or business. We are, you know, getting to a new, a new organization, if you like. And the leadership is the process of influencing people, of course. That's when you have influencing people, whether negatively or positively, or society toward a goal. But of course, the model leadership is the positive one, not the negative one. So if you take through history, for example, Goebbels, in the information minister of Hitler, will say, lies, lies, lies until you are believed. This is, I mean, he was a leader in his own, if you like, on right, but as a negative one. So as the leader, I'm not going to get into politics, who is now denying the success or the presidency of the other chap, you know, somewhere else, you know what I mean, okay? Whereas in history, there's a lot of example of good leaders, including our Prophet Muhammad. You know, he's a model leader. So you lead by example, if you like. Okay. The innovative leadership, it has 4 elements: emotional intelligence, management innovations, innovative organization, that's our organization, and interaction with stakeholders, يعني your targets, what you are targeting. Okay, so the emotional intelligence, you know, it makes the leader effective in performance, can build trust and make people committed toward the goal. it becomes easy for him to do management innovations, develop innovative culture, and interact with the stakeholders. So that's the emotional intelligence. That's one important character of the innovative leadership. Okay, it makes the leader effective in performance and can build, and make people committed toward the goal. Okay. There are certain elements of the emotional, like self-awareness, which means having a deep understanding of one's own emotion, strength, weaknesses, needs, and drives. So this is, you understand, your team members' own, weaknesses, strength, things. That's it. That's part of it. And also self-regulation, which is the management of our emotions that caused by biological impulse. Yani we can regulate this ourselves. Okay, it helps in two ways. People with self-regulation can build an environment of trust and fairness, which is much required by innovative organization. It is trust. Okay. So this is one if you like element. The other one, innovative management innovations. What is the management innovation? Within this context, it sets the goal and the principles and policy to guide the innovations and in innovative culture foster to do the miracle by the employee. يعني the way you encourage them so that they do the good things. Okay, so that's in simple words. Okay. The other two elements just within the organization, the leader, of course, when inside, that's the other element. So is it emotional, management, organization? So within the organization, and then you need to talk to the stakeholder. That's your targets. Okay, that's the health workers or the public, the layman, the whatever. Okay, when inside and you are ready for the innovation, the leader interacts with the stakeholder for ideas and feedbacks. You shouldn't just impose, should interact. Okay, and need to apply sense, of course, when to be innovative and not to be. Okay, it is not a copy and paste. I'm not going to copy somebody leadership style and apply it to this our organization. Okay, we need to tailor this to our needs, if you know what I mean. Okay, so that and we know our targets, we know our employees, and so you need to know your team. Okay, in order, and of course the good leader, there's a positive leader and negative leader, as we said earlier, but the positive leader we are after. Okay, and who leads by example. Okay, and who is decisive, strong, but at the same time kind, and understand his team actually. So I just been called to the exam again because I'm in the middle, in between. Okay, so I'm happy to send you my slide. I'm sorry about this, but I'll try to join you later if I may. Okay, I'm very sorry about it.
Okay, thank you so much, Dr. Majid. Thank you so much. Now, Dr. Professor Salman Al-Rawaf, lecture titled Leadership and Specialty.
I'm going to leave it, although I'll just talk. Thanks.
Click your voice, Dr. Salman. Dr. Salman.
I would like to thank my two colleagues for the excellent introduction to the subject. Hi, everyone, again. And pleasure to talk about a topic which is close to my heart. I think the issue of leadership in health, and especially in various medical specialties, is quite complex, and simply because in many countries, almost the leaders are emerged leaders. They are not-trained leaders. In many countries, they are appointed leaders. And this is a problem which we encounter from time to time. And if we look what the whole issue of human security in recent years showed us, that actually COVID pandemic is exposed some of the weakness and indeed strength of leadership. It depends where you are. There are some exemplified countries with fantastic leadership during this situation. On the other side, we've seen in other countries that's certainly not the case. The sort of challenging role of the policymaker in such a globalized world. I mean, we are a small village now, you know, and we communicate 24 hours, and we are close to each other in an unbelievable way, and the things which we never seen before. And the most important things, I mean, this is what COVID proved to us, that we're sharing this space. It's about shared destiny. And any local action, no longer local, it may have global consequences. And the reason I mention this, because when we look at leadership, sometimes people say, look, this has nothing to do with you, this is local. No, it's not local. The same things if leadership in certain specialty, it will affect the whole space, the whole organization. It could be sometimes the whole health system. And as long we exist, and I just want to mention this, communicable diseases, because I have to put it in the context of COVID, the communicable diseases will be with us for some time to us. And we've seen the impact of that, etc. I just don't want to talk about how much money available to rich countries, although it's important maybe, but I just want to show you how much wealth exists in rich countries, yet in the absence of leadership, we've seen the chaos in the United States, across some European countries, while limited resources countries, some of them, they exemplified themselves, and we have to acknowledge that. And today we have the pandemic, we have many challenges, although it's marginalized because of the pandemic. We have a system which is not resilient and therefore not fit for purpose. We know we have many choices, but are we choosing the right one? We know we're facing difficult decision, but are we making the right one? Fear, confusion, no clear direction, all exist. And all these are precursor to affect the quality and the type of leadership engagement and decision. And again, a lot of people ask who's in charge, whether the governance of system, of organization, of people are within the frame expected. Let me show you some example of failure of leadership, failure of leaders within the health system. Who is a leader? I think both my colleagues, distinguished colleagues, all define their leader from their perspective. I think the one who demonstrate a specific set of role of behavior, whether emotional or non-emotional, but the whole idea is to influence the attitude and behavior of others. And that's very important, that you create followers. People will follow me in my leadership role. And this is really very important in terms of the influencing people, attitude and behavior. And each leader attribute or style, because the style of leadership is important. make him an effective leader. But also that doesn't come from sort of empty background. I think in today's world, and I've seen this over the many years in leadership role, that unless you have organizational skill to manage the process, you will become a bad leader. And that's why we've seen when somebody given the role of a minister and given the role of, a minister is political, let us avoid them, giving the role of running a hospital, medical city, whatever, you know, and without any background in management, in organizational skills, understanding what the organization means, you know, including finance, etc., then learning on the job is not good enough. By the time you learn, which need maybe some time, couple of years, either you are transferred or you are doing more damage than good. And we've seen it everywhere. And if you look at the way health systems are strengthened everywhere in the world, number one priority for strengthening that health system is about leadership stewardship role. And yet is not given the enough attention in terms of training, in terms of putting the right people in the right place. Let's look at the lessons. This is ongoing lesson. And we've seen around the world how the paralysis, even within specialties, how we've seen how weak primary care leadership was, you know, at the start of the pandemic. Simply the excuse was they were not involved in the planning and the preparedness for any acute event, which is true. And I side by them. But for those in hospital, which are well-trained, well-rehearsed, we've seen the chaotic in leadership and the decision-making, and some of the hospital almost paralyzed. They couldn't really create more sufficient bed, the issue of PPE, and the issue of handling the rota or handling cases of infection among healthcare workers. We can see it, and we can really build many case scenarios and saying this is a lost leadership because they were not trained in organizational issues. And the example which is I bring you from recent history is the Mid-Staffordshire NHS in the United Kingdom. A small team from Imperial looked at the data in that hospital, indeed many hospitals, and they found that there is an excess of death in accident and emergency department exceeding 1,500. When they presented the data before publishing it as a paper, it was meant to be a research paper, of course, the trust immediately rejected that. They denied this, you know. That reached the government, and Department of Health commissioned a team from outside the country, you know, academic institution, came, look at the data. They said the data is absolutely accurate, even maybe slightly misunderestimate of the number of deaths. So they set an inquiry, very famous inquiry in the United Kingdom. And that inquiry changed the face of medicine, to be honest with you. And if you look at the conclusion of that inquiry by well-known barrister and attorney, the calamity of a weak leadership within the National Health Service in that organization, the calamity. And what they found that the accident and emergency department leadership was very weak. Indeed, this is within that specialty, the nursing leadership ignoring everything, the medical leadership blaming the nurses' leadership, and the board who's supposed to oversee the governance of that institution ignored a report written by individuals warning them about the lack of the leadership and the conflict within the organization. But of course, no notice was taken by the board. This is the Francis inquiry and volume of these things. And all of us in the health services at that time and leadership role, we studied these page by page, trying to learn from it. Did we learn? Maybe, I'm not 100% sure. And I think when we look at that dimension, the role of leader is to really provide a clear direction, a clear purpose for that organization, motivating teams, motivating everyone, and focus on improving performance by encouraging people to work together. And I think I looked at it on many occasions in my many years of leadership role in the NHS. And indeed, it's fruitful when you bring all these three elements together. And we've seen over the years how the focus of leadership changed. In the 60s, which we don't remember it, I mean, the task was focusing on task focus rather than people orientation. In the 80s, we move into transformational, charismatic, visionary, inspirational leaders, this and that. We knew about the name, Henry Ford, that one. And then we moved into entire organizational leadership. But today, it's about style of leadership. Today, about situational leadership. People who could really change their style very quickly, depend on the event, depend on the situation. Something, unfortunately, we didn't see it as example during this pandemic. And I put here the summary of the theory of the leadership. And if anyone wants this slide and references, it will give you some background. It's a bit crowded, I'm sorry, but I meant to put it as a last slide and as a reference for people who want to study it. I simply summarize it here to you from almost the 18th century up to now, which has provided excellent background. Thank you very much indeed. Thank you.
Thank you so much, Dr. Salman. Now, Dr. Abdelamir Mahsen, he will talk about limited time or long-term health leadership by the same person being inherited for his offspring. How does this affect public health education and providing updated and better health services? Dr. Abdelamir.
Thank you, Prof. Maitham. Good day for everybody. It's nice to see you. I will start my talk in question. Why is leadership important in healthcare? Healthcare sector is characterized by constant reform aimed at the efficient delivery of safe, effective, and high quality care. Effective leadership is required to lead and drive changes at all levels of the health system to actualize the goals of ongoing reform in healthcare organization. You might improve the system, procedures and processes, but you might lose the whole purpose of healthcare. For that reason, leaders must realize the impact of psychological challenges of dealing with healthcare. It's not like running a business. It's not just command and control work. It's about difficulties and the challenges that we as clinicians are faced with when we deal with the people. How we manage that in ourselves and how we do manage that with the patients. We haven't really paid enough attention to the anxiety produced by the kind of work that we do. Social system change cannot happen unless people feel free and safe to raise the concern and to do things differently and to use their imagination on an everyday basis to solve problems that requires leader to create an environment in which people do feel safe and can be supported when they need help. Are the leaders born or made? Research by psychologists has proved that in the main, leaders are mostly made. And the best estimate offered by research is that leadership is about 1/3 born and 2/3 made. The job of leading a health institution and doing so effectively require a very complex set of skills, mostly acquired through experience, self-development, as well as access to subsequent training. To expect that a person would be born with all of the tools needed to deal just doesn't make a sense based on what we know about the complexity of social groups and purposes and process. The fact that the leadership is mostly made is a good news for those of us involved in leadership development. Leader can indeed be developed. However, in 1/3, there are some inborn characteristics that the great leader have naturally, which they use to their advantage. A natural born leader. Does this mean that introvert person of average social intelligence or those of us who are not particularly empathic will not make a good leaders? Certainly not. Most of leadership is made, not born. So if you have wish to positions of leadership, then the best course is to embark on leadership self-development plan. Unfortunately, there is no governmental interest in leadership and in leader development. And for that reason, we need to emphasize on self-development of leaders rather than getting leadership development from a costly program or government. To be a successful leader, whatever their leadership style or type and so on, must choose the right action at the right time and keep a steady eye on the ball. They must be courageous, self-aware, and ensure the consistent support of their team of followers. This is a skill which needs to be practiced. Research suggests that, for example, that extroversion is constantly associated with obtaining leadership position and leader effectiveness. Leaders also need to be able to analyze situation and figure out courses of action, and so intelligence is associated with leadership, although perhaps not general IQ, but social intelligence and an understanding of social situation and the processes is the component most important for leadership. Finally, some sort of empathy or ability to know one's follower is also advantageous for leaders, although much of this is learned. Lead by example. Leader has important role in terms of role model, and the value and the way of interacting are contagious. The behavior of leader will be replicated everywhere in the institute. So if that is a leader or make an atmosphere of bullying, that will be replicated throughout institute. So leader on their own cannot do anything, but they are very influential in creating a culture and a climate in which people work. We need to rebalance the system, particularly from medical education. We need to balance the humanities as well as the technical and medical area, because it will increase specialization means that is increase fragmentation of services, and it is the patient that loses out in the gaps between the specialization. The leader must be able to know that followers want, when they want it, and what to prevent them from getting what they want. Also, expertise say true leaders ensure they continue to develop their leadership skill throughout their careers, through learning and development materials and activities. Fortunately, there is tremendous interest in leadership and in leader development. Self-motivated leaders may consider embarking on their own leadership development program. And healthcare leader must stay up to date with innovation, hold convictions, and be bold enough to make changes they truly believe in. There is no one corrected way to be a leader, but an array of different characteristics and traits that are evident in good leadership. I think in the near future, there is a lot of changes in the health care and health system management. And part of, we'll see changes in the health in the near future, like soft skill, soft leadership, also regarding medical education. It's a lot of changes will happen in the near future, we expect. And we see that through this pandemic, we live in it at the time being. Thank you. Thank you for you.
Thank you so much, Dr. Abdelamir. Now, Dr. Hector Castro. Dr. Hector.
Okay. Thank you very much for inviting me to participate and also to be one of the initial founders and creators of this very wonderful organization, I believe. And I think that we have a very important opportunity to set the stage and set the dialogue for ongoing conversations. From, I was asked to speak about how leadership can be adapting. I call it adaptation of leadership during healthcare crises, and also when new things are developing, and also how to communicate this, not just to the public, but also to other leaders. Yes. I'm a formerly trained critical care specialist. So we're trained to understand that what we're doing today is going to be the wrong thing tomorrow. So that we have to constantly understand that in our field of healthcare, it's an ever-changing, ever-evolving perspective. Having also spent 25 years of being a teaching doctor at the Mount Sinai School of Medicine in New York City and New York Medical College, I learned a lot about how to create leaders and also how to prepare them for the future. Unfortunately, there is a tendency in our field and in the world in general to tell people that this is the recipe. This is the way that it should be done. And this is the only way. And sometimes it cannot change. Because if it changes or you try to change it, you're a pariah. You can be ostracized and criticized. We are all healthcare professionals. We are all scientists. That means that we're constantly learning. That means that we have to have a proper mindset of understanding that we do the best that we can with the information that we have in front of us, with the full understanding that it might change, circumstances might change. For example, the coronavirus pandemic has shown a lot of things to us, good and bad. But it is our basic skills, education, and open-mindedness that will carry us through this whole pandemic. Learning, unlearning, and creating for the future, and also educating new people. So when we talk about a healthcare leader, the word leadership can be a double-edged sword, because I am the leader. I am the boss. I'm the one that knows. And we first have to understand that we have to be very humble. Humble in understanding that sometimes we are given the privilege, the honor of being a leader. One of the things I always taught my students is that you have to understand that it is the patient that has given you the honor of you treating them. That's a very sacred honor. And that also applies to what it is when you are a healthcare leader. One of the issues that we have to train ourselves for, and also set, as all my colleagues wonderfully stated, that we have to establish a pattern of leading by example, but that leading by example also means being humble by example. Teaching the people that we don't have all the answers, that we don't know all the answers, that we might never have the answers. But as a true leader, we try to chart a path. We try to chart a path that maybe will get us as far as we can, and maybe we as leaders will not be able to finish the journey, but somebody else, the new generation, or sometimes the old generation, will be the ones that will carry us through. So specifically, when you are a leader in a crisis situation, sometimes the tendency to become an autocrat, to take control and say, this is what we need to do, that has to be balanced. Sometimes we do need, again, as an intensivist, I get called in by other doctors to help take care of very sick patients. At that moment, sometimes there's no opportunity for a full discussion. A decision has to be made. But understanding that at the same time, you have to also educate your other colleagues and also educate the public or the patient. And that's a very difficult task to do. And most leaders have a hard time doing this. Not just leaders in healthcare, but also leaders in the world of politics and even in business. And unfortunately, we've had too many examples in the general world of people that have faltered in the settings of the coronavirus. So when we look at a health leader taking control in a situation of a health crisis, you're playing many different roles. You're seeing what's going on. You're trying to make a decision as to what it is that needs to be done in order to put out the fire, put it under control. But at the same time, you're learning. At the same time, you might realize that what you've been taught is wrong and then immediately come up with a new way of looking at things. And at the same time, on a third basis, you have to educate the people around you, the people that are looking to you for guidance. So that's a very difficult job. And as our colleague was just saying a little while ago, we are trying to create leaders. We're trying to educate and promote leadership. But maybe one of the things that we have to be concentrating on is just creating people that have a good sense of humanity and a good sense of logic and what we call in critical care, critical thought process. Because we do want to teach people to be good leaders, but we also want to teach them to understand that a lot of times they're going to be faced with situations that they are not going to be able to handle, that they're not going to be able to understand, but yet they can still be leaders. They can set the path, they can set the course. One of the things that concern me a lot in healthcare, and I tell people, imagine about 50 years ago, a very crazy doctor came to a patient and said, you know what? You have a heart issue. You have a blockage in your coronary, and I'm going to take a vein from your leg and sew it in your heart to bypass a coronary. At that time, that was crazy. That was unheard of. Now it's routine. Now we do all those surgeries a day. That is what the field that we're in. What I want to lead towards right now is this concept of what we call evidence-based medicine. Now it's called performance or precision medicine. That's good, that has a place, but in the real world of medicine, it can be destructive because sometimes it makes people resistant to change, resistant to adaptation. I have a book that I love to read and I read it all the time. It's called Studying I Study and Testing a Test. It's written by Richard Rangelmountain. Again, it's called Studying a Study and Testing a Test. It's a book about studying the things that we say are the standards. It's a book to study about what we think is the norm and realize that maybe it's not. That is the nature of our field in healthcare. And as a healthcare leader, we have to be willing to accept that maybe we are wrong. As I said before in our previous discussions, here in the United States, the most richest and powerful country in the world, in which we spent $4 trillion in healthcare last year, in 2 weeks. 2 weeks, the whole system collapsed. Why? Because we were not prepared. Why? Because we thought we were prepared. Why? Because we thought that we were ready and we had everything we needed. And one last thing that I like to finish is anytime we talk about healthcare leadership, anytime we talk about doing what's best for the community, education and everything, we also as a healthcare leader have to be mindful that unfortunately the cost is always a factor that we have to consider. And so as an efficient healthcare leader, especially in a time of crisis, we have to be able to speak to the people that have access to the funding for changes in healthcare. Changes sometimes that are very expensive. We have to be able to communicate with them and explain to them how an expense today that nobody was preparing for would save us money in the future, or more importantly, will save lives in the future. So in summary, when we talk about healthcare leadership in the time of crisis especially, we have to be able to not just communicate amongst ourselves, to teach and learn and listen, because we don't know everything, but we also have to be effectively teach the community, because one of the things that we have all seen during this pandemic is how ineffective communication to the community, and sometimes by design, can cause major problems. Hence why here in the United States, we are having more, we just hit 90,000 patients hospitalized today in the United States. And we're going to be hitting nearly 260,000 Americans dead because of inefficient leadership. And sometimes that inefficient leadership is remaining silence. Thank you very much, everybody.
Thank you so much, Dr. Hector. Thank you so much. Now we have the open discussion. Dr. Jizal. Okay, Dr. Fadel Umrani, please. What point do you want to discuss with speakers? Please open your mic.
Okay, good day. Really, I'm interested to hear this scientific talk about health leadership. I have two questions, one for Dr. Abdelamir, and I think it is a very short question, and the other question for Dr. Hector, and it is, I think, a very long question. So I will start with Dr. Abdelamir. How you can apply the topic of your talk to yourself as a health leader for Iraqi Medical Association?
Thank you, Prof. Fadel, for this question. Although I prefer this question to be asked to our colleagues, not me, because it's difficult to criticize yourself, as we know. But in brief, of course, I got a lot cumulative experience from my gradually increased experience since I work in different positions, from primary healthcare manager to general hospital, then specialized center. Also my work as a teacher in medical school and communication with WHO, and working as a national focal point for patient safety program. This cumulative experience helped me to lead the syndicate in this difficult condition, as you know, regarding security, social, and economic condition in Iraq. Although it's not ideal, but it was a great challenge. Thank you.
Okay, thank you, Dr. Abdelamir. The second question for Dr. Hector is how it is possible and effective to have monitoring and scoring for health leaders by third party, annually or even shorter. I mean, digitally assess and put a score limit, not to continue leadership below a defined score level. Scoring, for example, leaders' vision, a desired future and update, magnitude of innovation and change, ability to build effective teams. I mean, effective teams without inside team conflict. How can the leader create positive work cultures? Self and relative benefit versus health service providing. How is the health leader against and far from it? And how is the effectiveness of his plan in disease crisis or unusual health conditions? How you think this is possible and effective, I mean the scoring system, in improvement of health leadership, especially in developing countries? Okay, thank you.
Yes. Oh, very interesting questions. I think that part of the biggest problems that we have in creating effective future leaders is the way that we're educating the new leaders. And I'm going to only give you my experience here in the United States healthcare educational system for leaders. It's for doctors and nurses, but specifically focused on physicians. Unfortunately, over the last 30 years, we started specializing too much. We have doctors now that only specialize in the right hand and not the left hand. And as a result, their scope has narrowed. And unfortunately, that also means that their understanding of what's going on in healthcare and in the community is narrowed, so that when they do become a leader, they end up having a very narrow focus and understanding. Currently, the current president and CEO of Mount Sinai Medical Center is a physician assistant with a very large pattern of understanding. So when we talk about how can we train leaders, I'm a very big proponent that we need to start training everybody in healthcare. See, a leader can only lead as long as the people he's leading have a sense of what's going on. We teach children from first grade how to write, arithmetic, how to wash their hands, how to put on their clothes. I propose that we should start teaching children from first grade healthcare, medicine, because the more that we educate our communities about healthcare, the better it will be easier to lead them, number one. Number two, we have to look at the way that we're educating our doctors and nurses, the future leaders in our industry, the future leaders in our fields, because we need, I'm formally trained as an internist, and I trained in Mexico and in Latin America, where we have the community-based community health center. I was sent to a village, and they said, you're the doctor. You're the OBGYN, you're the pediatrician, you're this. We need to start training our doctors the way we did many years ago. Unfortunately, because of inefficient, we want to be more efficient. And here in the United States, at least, there's been a big move of reducing the amount of training hours. And that has a consequence. Now, so that if these doctors end up becoming the leaders, we need them to have a very wide focus of understanding of healthcare and how it can be provided. I agree with a lot of what my colleagues have said. And unfortunately, when I graduated my postgraduate training, after 4 years of college, 4 years of medical school, I did 7 more years of postgraduate training in 3 specialties. It wasn't until I had 10 years of clinical experience that I didn't have to look at a book as often. We have to accept that we need to have maturity. We need to have experience. And we have to look at that at our leaders. There are leaders that right out of school are very efficient and can lead very effectively. But we have to be honest that we want quality and experience and humanity. And these are the ways that I see that we can start. I don't know the answers. Start addressing it.
Oh, thank you.
Okay, thank you so much, Dr. Hector. Now, Dr. Gisal, please go on for your comment and discussion. Open your mic, please.
You are muted. You are muted.
Yeah, Dr. Gisal.
Hello, Dr. Hector. Can you hear me?
Hello.
Yes, I can hear you, Dr. Zan. How are you?
I'm good. Thank you so much. My question is, what makes a good leader? And does gender affect a leadership? Does gender really matter in leadership?
Excellent question. And actually, it's interesting because just last week I saw a study that came out. I forgot the organization, but it was a study in which worldwide that asked about whether men or women are more effective leaders. I believe it's in healthcare. I apologize, I'm paraphrasing right now, but it was very interesting to me that over 60% of people said that women cannot really lead, etc. And the reasons why I bring that out is because there's still certain concepts in the minds of people. And for me, I have no problems actually, starting with the fact that my mother was a very successful businesswoman, and everything I learned when it comes to being able to speak and communicate and sell, I learned from her. And I've had the pleasure of training with, and other female physicians that there is no difference. Actually, here in the United States now, over 50% of all the new admissions to medical schools are female. So I think that first and foremost, there is no difference. Unfortunately, for various points of origins of our understandings, we have certain concepts, but as the world continues to move ahead in time, we will all realize that there is no difference. That is why, for example, I personally have two daughters, and one is finishing medical school. The other one is an accountant and going into digital marketing. And I teach them to stand on their own, and I teach them to be very, very strong when it comes to dealing with the world. There is no mutual exclusivity. But yes, I personally feel that there is no difference. I think that it's just a matter of perception. And unfortunately, women in the healthcare field have never really been given the opportunities to really explore their potentials for various reasons. And it doesn't matter the reasons. I think that women right now are in the process of showing what they're capable of doing. And I think that a lot of our male colleagues in regards to healthcare and even science, they are welcoming them because now we have a workforce that automatically doubles if we include our female colleagues.
Okay, thank you so much.
Yeah, question. But Dr. Hector,
You have another question, Dr. Gisal?
Yes, it was a nice reply, and I am totally, I give my affirmations to your advices and all that thing. Another thing is that, do you think there is a strong relationship between age and leadership in all sectors of institution? Well, I think so, because like older people can generally give better advice than young ones. And nowadays, evidence for the link between age and leadership can still be found in professions that require a considerable amount of specialized knowledge and experiences, such as in science, in politics also, and in medicine also.
I agree with you 100%, and I'm a very big believer and tapping into the people in our communities that have experience. And in the past, we always used to go to the town elders. They were the ones that had the experience and can guide us. And unfortunately, we have a new generation of people that feel that they already know it all. And they don't appreciate that they need to get the experience. I think that in the end, it will all pan out. But yes, I agree with you. And I think that we should tap into the many members in our communities, including the healthcare community, that have seen it. I was trained by doctors who said, I don't want to know what you know. I want to know how many times you've seen it and how many times you've done it.
Okay, thank you so much, Dr. Hector, and thank you so much, Dr. Gisal. Now, Dr. Saad, if you have any question to speakers.
Dr. Matham, and many thanks for all presenters for their nice presentations. Actually, I have a question for every one of our colleagues. First, for Dr. Salman, as he said about the situational. You hear me, Dr. Salman?
Yes.
Yes.
It's a bit faint, but carry on. Yeah.
The future trends of leadership, the scope of review is about the situational leadership. Do you think the organizational and the structure of our health institutions in Iraq accept for such visions of leadership? And how do you evaluate this, the kind of the current leadership, health leadership in Iraq?
It's, I mean, thank you very much, Dr. Saad. Excellent, good questions, and very practical, and also sensitive, if I may say. I mean, first of all, it's unfortunately in many countries in the Middle East, this is not Iraq specific, that the leaders are not trained for the leadership role. I think Dr. Abdelamir quite rightly said, you may be born as a leader, but you cannot be a good leader unless you actually trained in leadership and organizational theories, etc. You need to understand what does it mean, health management and health system and how they work and the various components. Appointing a doctor to a leadership role is the system which is exist in the Middle East, you know, without any background. So situational leadership is once you are in a leadership role, each one adopt a style. And unfortunately, we looked at that in various studies, which some of it I'm involved in it, and we published it. When you look at situational leadership, because each one of us adopting style, we have a style of dictating, telling the people. I mean, this is very common style. The second style, leadership, which is really listening leadership and participating leadership, you know. But generally speaking, we have to train in changing our style. And a good leader, you know, he could direct in certain situation, i.e. telling the people, and this is the telling style. He could mix it with participation, listening to the team, listening to the people, because sometimes you miss certain things. And sometimes you have delegating the whole function to the people with expertise, which you have to trust all the people working with you. When we run leadership courses at Imperial College, you know, my WHO center do that for the last 25 years. And from the Middle East region, we have a lot of courses for people from the Middle East region. We saw their style, they are unwilling to delegate, you know. When we assess them and we assess their leadership style, almost everyone coming from the Middle East, they have zero. And by the way, the Chinese the same, which we found in different culture, people from China, people from South Asia, you know, And like the European and American, they do trust people and delegate. And when you ask them, why don't you delegate? You know, they said, I don't trust people because people may stab me in the back. People may do this, people may do that without my authority. So the issue of authority, it is not shared. It is not linked. And therefore, we train people in these sort of situational leadership exercises that they need to identify what is the event that they are dealing with, what is the decision they are taking, and what is the need to bring all people together, and they change from one style to another. As I said, there are these four most common styles used in leadership.
Okay. Thank you so much, Dr. Salman. Dr. Saad, another question to
Dr. Abdelamir and one for Dr. Victor.
Okay, Dr. Abdelamir.
Dr. Abdelamir, thank you for your presentation. What are the scope of the future leadership as you see it, and what are the changes which has occurred in the leadership, health leadership within this century?
Thank you, Dr. Saad. I mentioned in my lecture, my talk about the changes that will suspected or expected in the future. From the condition we face it in the pandemic right now, a lot of things changes even in medical care and in dealing with the patient. And as I know, a lot of research done in UK, and they see even survival rate is better when they communicate with the patient through electronic clinic. I think a lot of changes it will happen regarding medical education, regarding patient care, regarding even structure of the hospital. Everything will be digital. You may be you are at home and you do a surgery in UK or in US through robotic surgery. There is a revolution of electronic changes. Thank you.
Okay, thank you so much, Dr. Saad.
Short question for Dr. Hector. Thank you.
Okay, you have another question, Dr. Saad?
Yes, for Dr. Hector.
Okay, the last question, please.
It's time, Dr. Hector, do you think it is the time to adopt a module of health leadership to be distributed globally?
Yes, and actually I was just thinking about that as Dr. Amir was speaking, that healthcare now, as we know, is not just local and regional. Now it's worldwide. And as a result, we have to really focus on starting to train leaders in a worldwide basis. We have organizations like WHO, the United Nations, etc. But I think that we now formally have to really look upon developing leadership models, leadership modules that will address the healthcare concerns at a worldwide basis, which will involve a lot of collaboration, a lot of partnerships. But we need to start doing it because we realize now with this type of pandemic that we are no longer alone in our own countries, we're no longer alone in our own regions, and we're all brothers and sisters in the world, and we have to start taking that step forward.
Okay, thank you so much, Dr. Hector. Now, Dr. Afrouz, if you have any question, Dr. Afrouz. Dr. Afrouz. Dr. Afrouz. Dr. Afrouz.
You are muted. You are muted.
No, it's not mute.
Is it?
No.
Dr. Afrouz. Okay. Dr. Mohammed Al-Ta'i, welcome, Dr. Mohammed.
Also muted.
Okay, no problem.
اهلا، السلام عليكم اخواني الاعزاء. اعتذاري عن تاخري حقيقة كنت بالطريق مع الاعتذار إلى الزملاء جميعا.
Okay, no problem. Welcome, Dr. Mohammed. I think it was really very informative talk and lectures to improve health leadership. We will meet you in next webinar with a new trending subject. See you and stay safe, please.
Thank you. Thank you.
Thank you.
Stay safe, everybody, and thank you. I thought it was
Stay
excellent.
safe
Thank
all.
you.
Thank you very much.
Okay. Thank you.
Bye-bye, everyone. Take care.
Bye. Thanks.
Bye.